15 Democratic governors and Guam just launched the Governor's Public Health Alliance. Why now? What does it mean for vaccines, the CDC, and your state's next outbreak? Today, I'm going to break down why blue states are banding together, how this challenges the Trump administration and HHS Secretary Robert F. Kennedy Jr., and what changes you might actually feel. If federal guidance is confusing or cut back, states say that they need a playbook, which is about shared data, coordinated messages, emergency prep, even bulk buying of vaccines and supplies. Supporters call it science-first coordination. Critics call it politics in a lab coat. Either way, this could shape how quickly your community responds to the next health scare. And stay with me, because you're going to hear who's in this alliance, what it can do that a single state can't, what it can't replace at the federal level, and really the biggest question, does this become bipartisan, or is it just a blue state workaround that deepens the divide? I'm also going to get into what you might notice at the pharmacy, the doctor's office, and in school guidance. Here's the plan. First, what the alliance actually is. Second, why it formed now. Third, the pushback from Washington. Finally, what it means for you. Let's get into it. Think of the Governor's Public Health Alliance as a multi-state hub. The goal is to share surveillance and lab intel, align public messaging, prepare for emergencies, and coordinate buying of vaccines and other supplies. The organizers say it's about coordination, filling gaps when guidance is slow or inconsistent, while still working with national agencies. Members include California, Colorado, Connecticut, Delaware, Hawaii, Illinois, Maryland, Massachusetts, New Jersey, New York, North Carolina, Oregon, Rhode Island, Washington, and Guam. That's roughly a third of the U.S. population under one coordination umbrella. And why now? Governors point to federal turbulence, staff cuts, restructuring, and shifting vaccine policies. The pitch is simple. If national support wobbles, states will need a way to move fast, keep vaccines available, and deliver clear, consistent guidance to the public. Better to synchronize than to stall. The alliance calls itself nonpartisan and says Republican states are invited, but the founding members are all Democrats. Advisors include former public health leaders who argue states need stronger coordination right now. Whether GOP-led states join in on this is going to be a big storyline to watch. And what are they going to actually do? It breaks down into 4 buckets. Share data and early warnings across states. Draft practical guidance when signals from DC conflict or are delayed. 3, coordinate preparedness, stockpiles, surging playbooks. And 4, use group purchasing to secure vaccines and supplies when markets are tight. Critics at the federal level say the problem isn't Washington, it's that some states undermine trust during COVID, with closures and mandates and the other regulations and rules that they put on the general population. These critics argue that the current approach is returning to the gold standard evidence and that state alliances risk politicizing health further. Expect this debate to stay loud and be contentious. And the short answer about being able to replace the CDC by this, the answer is no. The CDC runs nationwide data systems and coordination that states can't fully replicate. The alliance isn't a replacement. It's a patchwork for speed, clarity, and procurement when national grills grind. And if you're a member of one of these states, you could see steadier vaccine guidance, quicker outbreak response, a fewer mixed messages probably. And if you're not, coordination can still spill over. Disease doesn't stop at borders, and it might nudge neighboring states to align. So is this the Justice League of Public Health or just a giant group chat with big spreadsheets? I don't know. Either way, in a world of fast outbreaks and slower politics, states are choosing to sync. That might not actually be that bad of a thing. Whether it becomes bipartisan or deepens the divide is the next chapter. If this helped, if it gave you some information on what's going on, tap like, make sure to subscribe. It really helps us get the message out. We're a veteran-run company, so reaching out is really important to us. And tell me in the comments, should states build their own public health safety net, or should Washington fix the one we've already got? We'll try to answer all your questions as you put them in. Thanks again for watching.